Hello guys, welcome back. My name is Mimbai and this is Clara. Today we're going to talk about cardiopulmonary resuscitation. We can call it CPR. We usually use it during emergencies whereby a patient is unconscious. That's the first one, and the second one is when they are not breathing, and the third one is when there is no blood circulation.
And we check for those things. For blood circulation, we check through looking for a pulse in the main arteries. Mainly we use the carotid artery that is right here by putting your two fingers on the neck. And if there's no pulse, well, some people use the hand pulse as well. You can check for a pulse there. And for breathing, you can check by putting two fingers, or if you have a glass, well, two fingers on the nose of the patient to see if you can feel anything. If you can't, for females, you look for movement of their chest, or for males, you look for movement in their abdomen. And for consciousness, well, you try calling the patient. Like if I just say, go, and she's not answering, well, I can just like tap her a bit, but don't shake because you don't know what condition they're in.
And also, we do not conduct CPR when the patient has epilepsy. And also when
they are bleeding.
Yeah, if they are bleeding and the ribs are damaged, you do not conduct CPR.
So yeah, you have to check carefully for those factors because you don't want to perform CPR on a person that does not need it, because it also has risk. You can break someone's ribs when performing it. So it's something that you perform when it's actually really necessary to save someone's life. And when you do it for adults, you use two hands, and then for children between the ages of 1 and 8, you use one hand, and for infants like little babies, you use two fingers, or you can use your thumbs. And your compressions are supposed to be 30 compressions to 2 artificial ventilations, or 100 to 120 compressions in a minute. So
we're gonna show you how to conduct CPR.
Spread out your hands to make sure you have enough space to perform CPR. So verify that your patient is unconscious. You can try calling them or check if they respond. Then you check for a pulse on the carotid artery. After that, you check for breathing. You can check the movement of the abdomen or put in two hands at the nose. If all the signs are absent, call the ambulance and tell them your location and that you're about to start CPR. First, you have to verify that the airway is clear, check the mouth for anything, and that the tongue is in the correct position. Place your hands on the middle of the sternum and then do your compressions, counting out loud so that you don't make mistakes. 30 compressions to 2 artificial ventilations. As we can see that I am counting out loud up to 30. You can use a salfette or a wet wipe so that you don't come into contact with the patient's mouth in case that you don't have the artificial ventilation tube. After breathing twice into the patient, continue CPR with 30 more compressions. And you repeat your 2 artificial breaths. So you breathe in air into the patient's mouth twice. That is how you perform an emergency CPR.